increase in the number of C-sections affecting human evolution. A few infants are too huge to fit through their mom's pelvis and would once have passed on in labor, in some cases killing their mums as well. It might be down to the obstetrical problem. Bigger babies are more likely to survive childhood, yet there are traditionally weights to keep ladies' pelvises narrow since it may help upright walking, as well as on the grounds that it diminishes premature birth. In such circumstance, cesarean segments that help troublesome birth, for example, when a baby can't fit through its mom's pelvis, are affecting human evolution, according to a new study. Be that as it may, do the cases stack up? Researchers estimate that between 3% and 6% of births worldwide are obstructed because the mother's pelvis is too little for the head or shoulder. Its utilization status had expanded from under 5% of births in the 1970s to more than a quarter for the vast majority of the most recent 30 years, as per the U.S. National Library of Medicine. NHS figures show similar rates for the UK. It is trusted that the measure of women'(s) pelvises and the span of babies' heads were finely adjusted over a large number of years of human development, with hips not able to plunge underneath a specific width if babies somehow manage to survive. But the increased use of cesarean sections means all that is changing, because women with hips of any size can now give birth to babies of any size. However, the expanded utilization of cesarean segments implies all that is changing in light of the fact that women with hips of any size can now give birth to babies of any size. The researchers devised a mathematical model using data from the World Health Organization and other large birth studies. They found opposing evolutionary forces. One is a trend towards larger newborns, which are more healthy. However, if they grow too large, they get stuck during labor, which historically would have proved disastrous for mother and baby, and their genes would not be passed on. Future trends. The researchers estimated that the worldwide rate of situations where the baby couldn't fit through the maternal birth trench was 3%, or 30 in 1,000 births. Over the past 50 or 60 years, this rate has expanded to around 3.3 to 3.6%, so up to 36 in 1,000 births. That is around a 10 to 20% increase of the first rate, because of the evolutionary effect.